All right, so we are live. So welcome. Today we're going to be talking a little bit about using health insurance for mental health care. And I am joined by the amazing Marina Murphy, who is a licensed social worker here in California, and also very familiar with the pros and cons of using insurance for mental health care. So just a little bit of background about how we got here, why we got here, because this is actually part of a larger project that we have been working on. And we looked at basically some issues with mental health parity as it relates to the difficulties that you as therapists have accepting insurance. We talk a lot about on the client side, there's a lot of issues, many of which haven't been solved, but then also on your end as a therapist, there are also plenty of issues. And so that's where we started. And then on the other side of that, we also basically wanted to take everything that we learned and put that into a guide for patients and clients so that they can understand a little bit of how the system works and how they can use some of that to hopefully leverage that information to get better care for themselves. So before we dig in a little bit, Marina, I'm going to let you introduce yourself and tell us more a little bit about your background and your amazing work.
Okay, well, thank you, Renee, for having me today. I am a licensed clinical social worker in the state of California. I own a group practice. We have locations in Upland and in Hesperia, California. And our practice is built around mainly the fact that we do accept health insurance. So we accept a variety of insurances. We of course take cash pay as well, but we want to make ourselves as accessible as possible to our community, and we have found that accepting health insurance is the way to do that. So currently, I have 20 clinicians that work for me at both locations. And we see everyone. We see adults, we see teenagers, we see children. I even have a couple of therapists that specialize in working with children under the age of 5. So you see the really little ones. And in terms of, the mental health concerns that come in, it's a wide range. Also, we have people trained in EMDR. We have people trained in trauma-focused CBT, people in trauma-focused yoga, meditations and breathing specialists within who are also therapists. So we really see people who are dealing, like I said, I feel like we have such an array of specialties and clinicians that we can help a lot of people who come in to see us.
Yeah, definitely. That's what's really cool, I think, about your work. You're such a great resource for the community.
Thank you.
So, it's really exciting the work that you're doing. And every time we talk, I'm always so impressed by how much work you're doing to support basically your entire community. So that's really cool.
Thank you. That's nice.
Yeah. So one thing I want to add for people who are if questions come up about insurance, if there's specific questions that you have, drop the comment section, and then we'll take some time to answer some of those later.
Okay.
If we can. All right. So I did want to talk a little bit about sort of the original project about mental health parity, and then basically what it's like to use insurance on your end, because as we had talked about many points along the way, a lot of people, like what you go through on the other side of insurance, is relatively invisible. So what are some of the challenges that you face as a therapist accepting insurance and working with insurance companies?
Okay, where do I start? No, I'll start with one that's really relevant to me right now, which is when you become a therapist, there's obviously a wider range of areas you can work in. But if you want to go into the private practice sector and you want to accept insurance, you have to go through this very long, arduous process of becoming credentialed with an insurance company. So we can't just accept all insurance companies. You actually have to go through this really extensive background check. And it can take months. Currently, I hired a clinician in July, and it is November, and we are still not credentialed with a particular insurance company that has very high needs in our area. I mean, I get multiple phone calls from their members every single day, and every day I have to tell them, I'm sorry, I don't have anyone to see you because we're all full And I'm hiring as much as I can to meet this need in our community. And the insurance company is taking a very long time to complete the credentialing process. So, I mean, hopefully it comes due. It usually comes due the beginning of the month. So fingers crossed for December 1st. But if we look at that time frame, that's 6 months. Who do you know gets hired for a job and waits 6 months to start day one? Right. So it's also very hard to retain clinicians, when we go through a hiring process like this. So again, there can be so many clinicians that want to do this work, who would love to do this work, but on the front end, it's a lot to get onto an insurance company panel. And each insurance company panel has their own credentialing process. So that's why you may see, like within my practice, we have 20 clinicians, but not all 20 clinicians accept every insurance, right? Like we have some that are here, some are there. And that's, just trying to spread the wealth here, because it would probably take me 24 hours a day, 7 days a week for months to work on credentialing for 20 clinicians. So we kind of hit the ones that have the highest need in our area, and get through that process. But that's one thing that I don't think the public is aware of, that sometimes they'll call and they'll say, but I thought you took blah, blah, blah insurance. And it's like, okay, yes, so-and-so does, but unfortunately we don't have anybody else who does. And, that person's full. So we can offer a wait list, but that doesn't help people who are in immediate need today. So it can just be, it can be tricky. It's difficult. So that's one challenge, which is just for a clinician to get on an insurance panel. That's difficult.
Yeah, definitely. I think that was something that was striking, is there's so many therapists who want to work with insurance companies, and despite, here in California, at least, there's a pretty well-documented provider shortage. Plus, there's such a high need everywhere that it's not fast or easy to get on a panel to accept insurance personally.
Yes, that's correct. And I am lucky, privileged to have a group contract with a lot of insurance companies. So I don't really have an issue when I do take on the process of getting those clinicians onto that contract. However, if you are an individual therapist and you want to apply, you have to apply to get credentialed, right? It's not like just a given. I have seen individual clinicians, I've had it done to me too. I think about it. I have had them reject. Sometimes they will reject that clinician, and they'll say they have enough providers, but that's not true. They don't have enough providers, or else I wouldn't be getting the amount of calls I get every day if there was enough providers.
Yeah, definitely. And yeah, we wouldn't be hearing from so many clients either who
right
find anybody.
Yes. So there's a provider shortage, and there is also the fact that a lot of providers aren't taking insurance.
Yeah,
so the challenge for people.
Yeah, definitely. Are there some other challenges that you particularly wanted to highlight on your end?
Some other challenges on the clinician end would be that insurance companies don't pay a fair rate. Should I just say that? So we can have the rate that is standard and customary for our level of expertise, our specialties, what everyone in the area kind of is charging, that. And the insurance company dictates their rates. So that is another reason why you may not see as many clinicians on insurance panels, is because the insurance company dictates the rate. There usually is no negotiating factor there. And they just say, you want to be on our panel? Okay, this is what we'll pay you. So we, that does, play into, again, what we do, because as private practitioners, we're not working for big companies here. We're working for ourselves. And so we pay rent on the building, we pay the insurance for the building, we pay our malpractice insurance, we pay to keep our license, of course, active. We have to take continuing education units every year, which we have to pay out of pocket. And that could be a little costly. What else? We have to pay for the ability to submit claims. So this is something that, like, the insurance company, we actually have to pay to submit the claim to the insurance company. So it's not like I could just send them a bill. I mean, I guess I could via paper, but that I don't trust that they would that they would actually process that correctly. So I actually have to pay for something called an electronic health record system. So I pay that fee every month, and I pay that for all of the clinicians because, of course, I'm a group and I am the employer, and it costs for every single person to be on that, and it costs every time I send a claim in. So, it kind of chips away at obviously what your hourly rate is at that point. And just to become a mental health therapist, many people have student loans, so they already have their education that they have to continue to pay on. And then we have to do continuing education credits. We have to pay for the additional education every year. So this just, again, chips away at your hourly rate. And when the insurance companies are not open to negotiating that rate, again, that is reasonable and customary. They'll say it's reasonable and customary, but it's not necessarily when you take all of our costs into consideration. So that's another challenge on the clinician's end is, how to run a business. You're running a business, a small business, but sometimes I think we're expected to act like, I always say, we're not Amazon. Like, we're not turning out a tangible, product. I'm not making something where we're providing a mental health service. And so, and then again, we are a small business. So our costs are different than that. So if you are an employer in the state of California, then you have all of those costs that it takes to become an employer in the state of California, which is also another thing that chips away at your hourly rate, right? So these are things, again, that can just play into the challenge of running a mental health practice, whether it be in the group context or in a sole proprietor context, meaning like it's just one person, is the fact that we're just at the mercy of whatever the insurance companies dictate if you do accept insurance.
Yeah, and I'm so glad that you listed out sort of, as a therapist, like as a small business, you're also a small business, and these are kind of the costs, because I think a lot of times people will say that, like the reasonable and customary rate is it's $125 an hour. It's like, well, I work for a job where I could charge $125 an hour, but by the time you're done paying all of your expenses, that is not at all like what you actually take home. Because running a business is very expensive.
Yes.
So, yeah, I really appreciate that you shared all of that, because there's so much that goes into it.
Right.
And another thing I think that is invisible.
Right, definitely invisible. The other thing when you talked about challenges is also the fact that I do, and I would say that most clinicians have experienced this that are in private practice, we get denied claims. So that would be, we provided the service up front, I submit the claim. Mind you, I don't get paid from the insurance company, sometimes 4 to 6 weeks out at times. Some are quicker, which is great. I appreciate those that come in at 2 to 4 weeks, but sometimes it's longer. So we get what's called EOB, an explanation of benefits. That'll come back, and it'll tell me on that explanation of benefits if they paid me for seeing that person or not. So remember that the person is their member, their insurance is active, but for one reason or another, the insurance company may deny the claim. A lot of times it is something that is it could be a computer glitch. It could be, one number is off on, on something. It could be anything. And the time it takes to try to chase down a denied claim is it's a lot. It's a lot to do. So we have to call them, they have to find it, they have to pull it up, they have to resubmit if it's that easy to just resubmit, or they have to find the error and you have to correct it on your end, then you have to resubmit. And then, so remember 4 to 6 weeks. So now, we could be 12, 18 weeks out from getting paid on somebody, or sometimes it's kind of like, well, we don't know what's wrong and I don't know why it's accepting it. And I have to account for losses as a part of just being in this business, because sometimes I don't get paid on claims. And so that can be very challenging, particularly for people who are, just again, like one a sole proprietor who's just doing the work, and if they're not getting paid for their claims, nobody works for free. So that's, we want to. So I always say, like, can you imagine if you like went somewhere and you did get, you purchased something, and we don't do that. Like, we don't provide the product and then get paid 4 to 6 weeks later, or then they say, oh, well, too bad, that person took it home and they have it now, and we're not going to pay you for your product. Like, I just did the comparison where I said we're not making things, but if we were to put something, if we were to try to do an analogy like that, it's really virtually unheard of. We just don't do that. We don't go to a restaurant, eat the food, and then pay them 4 to 6 weeks later, or say, oh, just kidding, I'm not going to pay you for that. This is really, from what I know, and maybe there's other industries that I'm just not privy to, but I don't know another industry that kind of gets treated that way. Maybe doctors do, because we are doing medical billing.
Yeah, that's true. And maybe to a lesser extent, but
right.
Yeah, that's a good point. It makes sense to compare it to, like, you're buying a TV, because that's how most businesses work, is you pay the money and get like all at the same time.
Right. Yes. And then the other thing that could be very difficult with that, just sorry to chime in here, is then having to tell the client, I'm sorry, we can't see you anymore. Your insurance is not paying. And that is so difficult, because they can be in the middle of their treatment plan. They can, be making great progress, whatever it may be. And we have to, usually what I try to say, okay, let's pause your service just so we can get this figured out. And of course, try to bring them back on board once we do. But, if we're, in my case, for instance, then I'm virtually paying my clinician out of the pocket to provide mental health care for that other person that the insurance company should be paying for. Does that make sense? So as a business owner, I just can't do that. And so I know that some clinicians feel very ethically torn with that, because how awful it is to have to say, I'm sorry, we can't continue your treatment. But unfortunately, we have to make those calls, because I have to keep my doors open for the others who are coming too. And I can't put myself at financial risk that way, right? So it is, again, just another challenge that we have to maneuver around. So I continue to carry a caseload. I see about 10 clients a week, but the majority of my time is spent as a group owner dealing with these kinds of issues, trying to chase down claims, trying to get credentialing through, trying to figure out what went wrong where, in terms of insurance and paperwork.
Yeah, and that's a lot of work. And I think that's also, we were just talking about a really good example of how the burden for mental health care actually gets passed down to you as clinicians, and then passed next down the line to clients. It's like, yes,
right.
Insurance companies should be responsible for this, but the burden is on you to make some of these really hard decisions, and then by extension, the client. And so I think some of this not getting paid, I think that dovetails really well into the client side of things, because clients also have to face some of these claim denials where the insurance company isn't paying, or there's all these treatment limits, or they have a really high deductible. So flip this question around a little bit.
Okay.
Then what are some of the biggest issues that the clients that you're working with encounter on their end from a client perspective?
Yes. So what I hear most often is that they can't find anybody in network to see them. So with insurance, if you have an HMO, you have in-network providers. So you can go and see whomever falls under your insurance's in-network provider list, right? So you can call the insurance company, get a list of people in your area that are in-network, and start making those calls, going down the list. And oftentimes people will say, I've called 6 people and they're all full. I can't get anybody to see me. The other thing I hear a lot is that therapists not calling clients back. So I would say that clients would say they don't get phone calls back. I in no way mean to justify that. I have tried to keep a system where we have a call log for every single person who calls, and that we return that call within 24 hours. I can't say that we're perfect at it, but I would say for us anyway, and I know colleagues in the field, I have heard similar things, is that sometimes we are so inundated with calls that, again, it's really difficult when you're seeing clients and doing all of these other things for the clients within the practice to also be doing, right? So I have often stated that I literally employ a person to tell people no all day. So, and that doesn't feel good. So, I mean, for two reasons, right? I'm employing a person basically to say, no, I'm sorry, we can't see you. But then also having to say, no, I'm sorry, we can't see you because we're full. So I certainly understand the clients who are frustrated sometimes by the time they get to us. Maybe they've made various phone calls. And so we've definitely heard some of those frustrations, which, I get it. It's frustrating because there are not enough providers, because there aren't enough people in network, because, again, people are so inundated, they're not calling back, or whatever reason, they're just not calling back. So I would say those are the two biggest things I hear whenever people call, is that just that they've tried so hard to find somebody. And a lot of times when someone is in mental health distress, like that's adding on to whatever's going on, right? That they're just so frustrated by the time, we pick up the phone. It's difficult. So I try to do different things to try to help people who get through us. Like, if I don't have anybody in network, maybe I have somebody that does have an opening. So I try to offer a sliding scale rate. And that just means that we'll reduce our rate. But we do have like a bottom line that we can't go past, just because then again, it doesn't make any financial sense. We can't stay in business doing that. And some people can take us up on that. And unfortunately, some people can't. So yeah, that's hard.
Yeah, definitely. And I was just thinking that, with clients not being able to find an insurance provider, it's like that first
Right.
barrier to entry. And so, like, as the guide, it's like, here's how to call your insurance company and find out like what your benefits are. Like, you could ask them, like, do you have treatment limits? Are there so many sessions that you can have? Do you have to meet your deductible first? Like, how much will your copay be? But if you get all of this information, you have your list of therapists from the insurance company to call, and you call, and there's so many therapists who don't have openings, especially when like making that first call is really difficult. Especially like, as you mentioned, if somebody's really sort of at a crisis point, having to do all of that is such a huge barrier to entry.
It is a huge barrier to entry. There's a couple things that if the client is in a place that they can advocate for themselves, like maybe they're, like usually in talking to them, we can kind of get a sense of what's going on. Can you or someone help you with this process, which would be, so a couple tips. I don't know if the insurance companies will like me saying this, but one would be, put it back on the insurance company. Call them and tell them, I have gone through your list and your providers are either, are not available right now, or I can't get an appointment. Because the other thing too that comes up often is that people also have other things to do other than attend a mental health appointment, at 2 p.m. on a Thursday. Like if they have an 8 to 5 job or something like that, then maybe they can't find a provider that is available from 6 to 8 on the weeknights, either because those appointments are very scarce and people gobble those up quick, right? Or again, they just can't find anybody who's working those hours because maybe the therapists are working 8 to 5. Like, there's, again, certain things. So whatever that issue is, why you can't find somebody, putting it back on the insurance companies. I have had phone calls from insurance companies before who say, I am so-and-so from member services or whatever, and I'm trying to assist this client in finding an appointment. Do you have any availability? So now the insurance company is calling around providers for them so that they're not sitting on the phone. Again, if they have a job or they have kids to take care of, or, now we're like, they have kids homeschooling and all of these various things, other tasks to attend to, instead of calling therapists all day long to try to get an appointment. So you can see if your insurance company offers something like that where they can help. They usually have like a case management department or something that will start to make the phone calls for you. So that would be one thing. Go ahead. Yeah, yes.
That is brilliant.
Yes. The other thing that can be done, they don't like to do it, they don't want to do it, but there is something called a single case agreement. So you have exhausted your options with in-network therapists, and you find an out-of-network therapist that you really like and you want to see. If that out-of-network therapist is willing and your insurance company is willing, you can do what's called a single case agreement. And that just means that the insurance company says, fine, there's nobody else for you to see. We will pay so-and-so, even though they're not in network, to see you. And so it's just like a contract just for that one client. They are not likely to do that often, but I've seen it done. I've had a couple. So particularly if you happen to be in Southern California, like in the Hesperia area, there's just, there's just very few providers, So if you are in an area where you just don't have access to very many providers, then that might be where they could be willing to do single case agreements.
Yeah, that's really good advice as well. And I think that speaks to like, you kind of have to know your rights, because I know like here in California, like legally insurance companies, if you can't find an available provider within like a specialty that will meet your needs within 10 days, like legally the insurance company has to provide that for you. Like that's written into law. So that's part of it. But then the other part is knowing what language to use. Like single case agreement is not like a common phrase.
No.
So I'm glad you brought that up, because like knowing some of these terms and knowing that some of these things are available, sometimes that's half the battle. I mean, ideally the insurance company would willingly help people, but unfortunately that's not where we are. So knowing some of this language is so important.
Yes.
So some other things that I kind of wanted to talk about on the client side and how to use insurance, how to advocate for themselves. What are some of the problem-solving things that clients might face? I know you had mentioned like denied claims, stuff like that. In your experience, what is the best way for a client maybe to sort of advocate on their behalf? So for example, like one of the situations that you had brought up is an insurance company is going to decide they're not going to pay. So, there's some advocacy that you can do as a therapist, but then what can that client do as well if they're really struggling?
Really it's just calling and speaking with the right department, and the client can advocate for their services. So you're right, I have seen that has happened before, where I'll say, we're having issue getting this claim paid. I have attempted to resolve it. It's still not getting resolved. And then the client is like, I'll call, which is great. When they're willing to call and advocate on their behalf to try to resolve that. That happens. That can be really helpful. There's, I don't want to name names, but there's one particular company that really does a lot more if the client calls than if the clinician calls. So sometimes I have said, I could do this for you, but you are more likely to get them to do it if you call, which would be, sometimes it's like as simple as, we need an authorization switched. Like I had a clinician recently who is moving on to something different. And so we are transferring her cases to another clinician. And that means we need to do an authorization switch. I have tried to get the authorization switched. It is not happening. So then I have to say, so-and-so, would you be willing to give them a call, because they're not changing the authorization and that will impede their services. We can't see them unless that authorization is changed. So yes, if the client calls, that we usually get a little bit more action than if we call. And that probably has to do with sometimes they call and they're upset because they're like, my therapist says she can't see me unless you do this, and then that will help. It just does. So
yeah, you gotta use all of your available resources.
Right. Yeah, because again, I'm a group practice, so I do have an admin support and I do have an office manager support. But a lot of clinicians don't. They're the therapist and they're doing all of that too to run their business. And I used to do that. I know what that was like. I've grown to this place of being able to hire an admin and an office manager to help me. But for many, many years, I wore all the hats. And so again, it really cuts into your time when you're having to stay on. I mean, I've had my admin text me and be like, I've been on hold for 45 minutes. So it can be difficult for both ends, the clinician and the client, to but again, usually the client will get through a little faster than we do.
That's really helpful to know. So it sounds also like if you're facing issues with your insurance company, it sounds like the client bringing it up with your therapist is an important part of that, because you have a lot of expertise. So you're the person who might be able to say, like, this is something that you should call your insurance company about, versus a client who has experience with one insurance company. Does that make sense?
Yes. Yeah, I get it. Yeah, they can. And it's kind of like just being a team, really, trying to get their to help them be able to access their mental health benefit and utilize it.
Yeah, definitely. Which is, ideally how it would work.
Right. Yes.
Okay. So if people who are listening, if you have questions, feel free to drop them in the comment section. It looks like we do have one.
Okay.
Christine, who says, I have private insurance and Medicare. Why do providers tell me that they have no one qualified to treat me? Also, what do I say to the provider that denies me services because I use a service animal? So what I will say, Christina, is I think some of this is a little bit individual. And so it sounds like maybe running into some issues with just finding available providers. But Narina, I don't know if you have any thoughts on maybe there's some ways to sort of approach solving that. Like, it sounds like maybe something where calling the private insurance company and Medicare and asking them and kind of explaining what's going on, and the insurance company, like you were saying, might be able to help advocate.
I would definitely contact the insurance company. So one thing too, when you have dual insurance, is we have to take into consideration which insurance is primary and which insurance is secondary. So let's say that her Medicare is primary. If her Medicare is primary, then she has to find a therapist that is credentialed with Medicare. And let me tell you, of all places to have the longest process of getting credentialed with, it's Medicare. So again, you're probably not going to find a lot of therapists that are in the Medicare network because it is just such a long process. And then the other thing is that Medicare also, I believe this is supposed to change soon. But for as long as I've been in private practice, which has been since 2007, they only credential LCSWs. So there's various credentials that can do what I do, right? There's PsyDs, there's PhDs, there's LCSWs, there's LMFTs, there's LPCCs. And Medicare has only allowed LCSWs. Don't ask me the rhyme or reason for that. I don't have any idea why that is, but that's the way it's been for quite some time. So I believe with some of the new laws that are coming into place, that's supposed to change, but I don't know exactly when. So I'm sorry that I can't give you that. I don't know if it's in 2021, but I would say, again, call Medicare. Let's say that the private insurance is the primary. Then you have to find somebody in network with the primary. Sometimes billing can be an issue. When you have dual insurance, I know it sometimes feels like, well, I have double coverage. That's great. It can provide another nightmare for the clinician to bill accordingly to who gets what. And then when they say they don't have anybody qualified, like that word in her question makes me think that perhaps, like you mentioned, it might be an individual issue if she's looking for somebody who has a specific specialty or is well-versed in a specific area, and you want somebody who specializes in that area. And so then here we go with this, like we're getting smaller and smaller, right? It's like, I need somebody to take Medicare. I need somebody who can bill both insurances. I need somebody who has a specialty in this area. Like we're really getting down to a very finite amount of therapists there because you're already starting out with therapists that take insurance, right? So like the circle keeps closing in and getting closer and closer. So I absolutely think that she should call whomever is her primary insurance. If she doesn't know what her primary is, that's one thing too. I would strongly encourage viewers to do. All people I come across with is understand and know your benefits. A lot of times people call us and they're like, I've had people say, I don't even know what my health insurance is. And I'm like, okay, did you ever get a card? Like to look, and they're like, let me look through my wallet, and like they find, okay, that's your insurance company, and so I mean, I think that might sound silly to some people, but it's really, you only a lot of times use it when you need it. So if you didn't need it before, you might not know. A lot of people don't realize that their medical health insurance carrier provides mental health treatment. So they don't even realize. I've had people say, somebody told me I can get counseling with my, medical benefits. Yes, you can. Oh, if I would have known that, I would have gone sooner, So there's lots of things that people don't know. So again, coming back to the original question, I would definitely find out, know your benefits, know what's primary and secondary, call your primary insurance, ask them to give you a list of providers. And if you're looking for something very specific, ask them if they can assist you in finding somebody in your area that has that. One of the nice things about telehealth right now is you can see anybody in your state. So that would mean they may need to look in a wider area and not the usual 50-mile radius of your home.
That is definitely one benefit of telehealth is
right.
A little broader.
And that's if the person is able to do telehealth, of course. And then the emotional support animal piece, I'm not sure if she said like they're not helping her. What was that last part of the question again? That it was
provider that denies me services because I use a service animal. That's the
I'm not sure if that means like she needs to bring her service animal and therefore they don't want to see her because of that. I'm not sure what that means, but if she has a qualified service animal, that's a protected act. And so she should be able, if she's going in person, she should be able to bring that service animal. But if she's doing telehealth, then that might not be an issue right now.
Yeah, I think that's a good point. And I think that speaks to just in general, sort of knowing like what your rights are. Like I have a right to find a provider within 10 days. I have a right to have my service animal wherever I go. I have a right to, all of these different things through your insurance company. I'm also glad that you brought up that like a lot of people, they don't know they can get mental health care through their insurance. Insurance companies aren't necessarily advertising like, here are all the ways you can use your insurance.
Right.
Yeah. And I think also on the other hand, some people assume that, oh, I have health insurance, I can just show up.
Yes, that's very true. That's very true. People will call and just say, well, but my insurance said I could, or feeling like I should just be able to get an appointment. And unfortunately it doesn't work that way.
Yeah. As I've done this work, it becomes clear that it's so complicated and nobody on the insurance side really wants to explain it. And, it's like you could be doing this forever and still not.
Definitely. Yes, very true.
Okay. So are there other things, other tips, other considerations that we haven't talked about that might be helpful for clients to know, or even for clients to know before they come to you?
One other thing I thought about while we were talking about how utilizing the benefit is if you have a PPO. And so if you have a PPO insurance, that can sometimes give you a wider range of accessibility. But one thing often people don't realize is that mental health falls into the specialty category. So that means you are typically subject to deductible. So if you have a $5,000 deductible, you have to meet the $5,000 deductible before your insurance company will pay for your out-of-network therapist. So that means you're paying out of pocket until you meet that. If something, unfortunate happened that year and you were hospitalized, or, sometimes it might be like we have women who come in for like postpartum depression, anxiety, OCD, and we're like, okay, great, you had a baby this year, so you met your deductible. Now, it's like, woohoo, we like get excited because we can actually utilize their benefit. But unless you met your deductible that year, you actually have to pay out of pocket to see your therapist until your deductible is met.
Well, in some cases, it's almost like it doesn't matter.
It doesn't matter, right? Like if you have a huge deductible, you could see your therapist 5 days a week and it's not going to hit your deductible, right? So but typically it's weekly. And so no, in a year, you don't hit your deductible.
Okay. So that's good to know too, that people should ask about their deductible and when and how that kicks in, because if the therapist is in network, then likely it doesn't have to go towards
it doesn't.
But
so again, knowing your benefits, because sometimes that does happen. I'm not going to say never. I would say, 1 out of 25, I will have it say I'm an in-network therapist and they still have to meet their deductible. It just depends on their plan. And that's the other thing. I mean, you can have one insurance company and there are so many different plans within that umbrella of an insurance company. So we can't possibly know everyone. We can't know everyone's benefits. So we do the courtesy of calling, just because I have found that to be better on my end, so that I don't, number one, we don't get denied claims. Number two, we don't start treatment with somebody and start a relationship and then have to cut it off. That's just not bad. That's not good for the client. So we do the courtesy of calling up front, but we've been told wrong things too. We'll call the insurance and we'll get a reading off of what their benefits are. And then when we send in the claim, it comes back and it's like, oh, they have a $50 copay and they didn't tell us that up front. So then we have to go back to the client and say, you have a $50 copay. For some people, that's okay. For a lot of people, that's not. They can't afford $50 a week. That's $200 a month. That cuts into grocery bills. That cuts into utility bills. That cuts into gas, so that can be really difficult. So unfortunately, if we have dual, you call, your benefit, we call, we hear your benefit, we have less miscommunication with the insurance companies.
Yeah, definitely. That reminds something, another therapist I was talking to said that, two things. So one, I know here in California, and there's likely similar protections elsewhere, but you have the right to request basically what they call like a plain language summary of your benefits. It's still not very plain language, but it's better than the notebook I've seen some people wielding.
Yes. Yes.
So that would mean that those are your specific benefits for your plan, and then it's in writing. So that's the other thing is one therapist had said, and you can let us know if you agree with this, Narina, is to get absolutely everything that they tell you in writing and then share all of that with your therapist, because basically the more information that you have specifically on paper, the better it is, the easier it is to make sure that things go as smoothly as possible.
Right. Yes, definitely. I didn't know about the plain language benefits. That's a great resource to have. So that's definitely something that everyone should request from their insurance company, so they can get like at least a summary that's in, less than, like you said, the books, right? So you get this big old thing, and who reads through all of that? Most people don't. Yeah. So I think that's great. Thank you for sharing that. That helps me too. And the one thing too that sounds awful, and I'm going to say it anyway, which is sometimes it feels like they bank on the fact that it's going to take me so much work on my end to chase down, like I said, like a denied claim or, whatever it might be, that it's almost like a competition in like resiliency, like who's going to give up first, And I would say that a lot of clinicians do, because again, it's like, I have clients to see, and I have a business to run, and I have, and again, spending all this time on the phone and emailing back and forth and, faxing and whatever it takes, right? It's really hard to see it through.
Yeah, and that makes sense on the insurance company, and there's certainly no incentive to.
Yeah, no, none.
Especially like an insurance company, it's like they have premiums coming in, as opposed to, like clinicians, you're waiting 4 to 6 to however many months, to get covered.
Right.
Yeah. Okay, so we have another question.
Okay.
From Ashley. And Ashley asks, how does one get their insurance to work with them in getting a therapist that is a specialist? So the insurance is only going to cover in-network. All of the specialists don't take insurance, and it's very expensive. Yeah, so this sounds like something that happens a lot, Ashley, and I don't know if you want to talk to this a little bit more, Narina, but, therapists are full or they don't accept insurance.
Right. So that's where maybe we can talk about that single case agreement again, that if she finds a therapist that's out of network, that is an OCD specialist, that she can go to her insurance and say, look, I've called everyone in network. They're not accepting patients. I need I need mental health services and I need a specialist in this area. And then you brought up the law that if within 10 days you don't get an appointment with an in-network therapist, then her right is to have an appointment with an out-of-network therapist. So now that she has that lingo, Ashley, I would encourage you to call your insurance and ask them if they are willing to do a single case agreement. I'd first find the therapist that is willing to work with that, because the therapist does have to do some work. Usually it's just filling out a couple forms, but if she has somebody that's willing to do that and meets her needs, then I would then say, call the insurance and say, I need this, and will you do this? And if she gets a no, I would say, okay, is there somebody else I can speak to that's above you? And just you can file a grievance with your insurance company. I don't know if people know that, but you can also file a grievance with your insurance company and state, what it is that you need and how you were denied access. And by law, they have to answer you.
Yeah, I'm glad you brought that up. Yeah, the grievance, particularly because something like that, it's written into law that insurance companies must make sure that you can find a specialist who is in network. And then file that grievance, and then that gets kicked back to the state. If you can't find anybody, there's some options on that side.
Mm-hmm. Mm-hmm. Yeah.
Sorry,
That's okay.
A garbage.
Of course. Of course.
Yeah, so that's a great question, actually, and I think that's something that happens to a lot of people.
Yeah, unfortunately. Yeah, I hope that she can find somebody by pursuing that avenue.
Yeah. Okay. So we are at about time.
Okay.
So I know that we dropped in the insurance guides into the comments here. We can also drop in a link to the original story, so you can read a little bit more about Narina, what you go through all of the time. Narina is also featured in there. And we're also going to drop in the information where you can learn more about Narina, follow her work on Facebook and Instagram, on her website. She's really amazing. And so to wrap up, I wanted to ask you, Narina, what do you wish that more people knew about using their insurance for mental health care?
Oh, what do I wish? I think what I wish is that people, it became common knowledge that utilizing your health insurance for mental health care is available. And I wish that the stigma around accessing mental health in general, it was lessened, and that we could all have conversations like this on the regular where we, share this type of, someone could say, oh, well, when I tried to see a therapist, I had to do this, like that. Just, it could be very similar to like if you had to go see a podiatrist, or, you need a new dentist. Like, I've seen people post like on Facebook, like, hey, I need a dentist that takes Delta or whatever, and that people are like, oh, I have this great one, blah, blah, blah. Right. Like that we could just have more open, transparent communication about mental health care in general. But again, also obviously how to utilize your health insurance in that way, because as we just discussed in this last 45 minutes, there's so many things that people don't realize or know. And I think that, like you mentioned, they don't advertise this. It's not well-known information. So it's almost like keeping us in the dark is keeping us in the dark, literally.
Yeah, definitely. That is a mic drop statement to end on, I think. So thank you to everyone for listening. And Narina, thank you so much for being here and for sharing so much of your expertise. It's always a pleasure to talk with you and to learn more about the work that you're doing. And so thank you so much.
Thank you, Renee, for making this such a priority. I really appreciate you. And thank you to everybody who listened today.